Hey, Megan. Good to have you here.
I'm excited to be here.
Yes. So I want to start asking with some just basic fun questions.
Okay.
Meaning you're from Oregon, but you've been all over the world.
Yep.
What is your favorite place to live?
I did love living in Asia because it was cool to see the Western and Eastern medicine. I think there's pros and cons of everywhere, and your job is just to find the things that are fun and interesting, enjoy, and find your niche, and then try not to worry about the things that are not great.
Right, it's the journey, not the destination.
Yeah.
You can live anywhere if you have your tribe type of thing.
Right, bloom where you're planted.
Yeah, sometimes I remember years ago I'd be God, I'm overeating and I'm depressed. I'm just going to move to California. And I'm from the East Coast originally. I was like, oh, but wait, when I move to California, my brain's coming with me. So
Yeah.
I need to figure it out here and now.
Exactly.
Yeah.
So I've been in the Pacific Northwest a couple years now, and they say there's no bad weather, there's only bad gear. And that's kind of true, because if you have the mindset like, oh, I can't go for a hike because it's raining, you're never going to go for a hike.
Yeah,
but
right.
you get the right gear, and then all of a sudden you're like, yeah, it's beautiful, it's raining.
That gear could be your mind.
Yes.
Yeah, there's only bad gear, meaning your inner critic and your thoughts.
Exactly.
Yeah.
Exactly.
Interesting. So our paths have kind of crossed. We were just talking about. You were at Bellevue in New York City working with
The HIV positive population,
Right.
and really looking at lifestyle. And so when we were able to have medications that really were changing HIV and living with HIV, then all of a sudden it became very important to also eat well and manage diabetes and all the other things. When we think about longevity and how long we're going to live, it became much more complicated in some ways.
Yeah.
But New York City had such a great community around it, and it was such an exciting time to be figuring it out. Kind of like the
Definitely
excitement around, IIN of this new kind of journey and a revolution, and things are changing.
Yes. And at that time we didn't know each other, but I was running the largest HIV site in the world, and now here we are. That's why I say things happen when they're supposed to, and we're in the perfect place at the perfect time, because now we're here and we're working together again.
Yeah.
Before we didn't know each other, we were working for a cause, and now we're working together. So can I ask, why were you interested in collaborating with IAN?
So I've been in healthcare about 20 years now, and every single job I've had, I always say that nutrition is the oxygen of health.
Yes.
And it's been valued at different levels in different jobs and things, but it has been such a fundamental piece of any successes I've had. And so throughout my career, I have looked for ways to bring in that nutrition. Now, I'm working kind of from the inside of the traditional healthcare industry complex.
You're an insider.
I'm an insider, but
Changing it from the inside.
Changing from the inside, and it has been slow and steady. And my healthcare system, PeaceHealth, we have the only CEO registered dietitian. So
I love that.
We are a huge healthcare system, Alaska, Washington, Oregon, and she is phenomenal, and she gets it. And she has allowed us to really be innovative and to think big, and she is a go build it. And so we were very excited to offer full scholarships to IAN to become health coaches for any of our 16,000 employees.
Oh my God, that's amazing. Any one of your PeaceHealth 16,000 employees can get a scholarship. So basically you're paying for schooling for them.
Yes.
What a wonderful benefit.
And not just our physicians, our providers, our nurses, our medical assistants, people that are touching patients every day.
Anyone.
Finance, marketing, HR. I mean, because we say the care for the caregiver. I mean, we really are all in it together. And so it is changing like our culture. And this next year, we're going to be able to extend those scholarships and gift them to our community partners.
Wow.
So our Meals on Wheels, our schools, our churches, our food banks that also need this knowledge, and we're trying to partner with them and to create this change, but we can't do it from all within the hospital.
That's amazing.
Yeah.
That's like putting your money where your mouth is. It's one thing for a big healthcare system to say we're interested in wellness and changing the world. It's another thing to do what you're doing.
Yeah. Well, we're all working with limited resources. I mean, it is at the end of the day, healthcare is a business in our country. And so I think it really takes a lot of creativity to say, yes, the money's there, this is how we do it. And only an insider can see where those opportunities are. And that's where the big growth I think is going to change in the
Right.
future here is that we're starting to get more creative about how we can create that change.
Interesting, yeah. So the IIN program can help them change their own lives, and potentially, oftentimes we see people take the program because they want to become a health coach, but they're also taking it because they want to just figure out how to transform their lives or their family's lives. It's so important we talk about what you should feed your children, because that's when Dr. Weil was saying, your bones stop growing at 23, so why don't you really get them strong before then?
So part of our process was that our employees had to provide letters of support. Now, they're not like letters of recommendation. They weren't formal. They could be from anyone. And so essentially I get to come to work and I call them healthcare love letters. Like I open these letters because they are written by sometimes the person's spouse or their children, the letters that children have written about their parents, about why their parents should become health coaches to help them in their soccer games. I mean,
yeah.
and parents and neighbors. And so it's been really incredible to just see those connections that people have said.
That's a great way
to
get people connected. How do you foresee health coaches being an integral part in the healthcare system going forward? We know that docs have fewer and fewer time, but how are the actual health coaches going to step in, do you think?
Well, currently, everything that happens in healthcare is in our hospitals or in these boxes, and we keep it all in those boxes, and we make the patient come to us. And that's how our reimbursement model works. If it doesn't happen on this X, we don't get paid for it. The beauty of health coaching is that what I think most people value and prefer and benefit from is somebody who can really walk the path with them. And for me, our most game-changing program is when you can have a health coach or nutritionist go with you to the grocery store.
That would be amazing.
I can talk at you all day long about nutrition, and you're like, yeah, I got it. And you can keep the most accurate food log ever. And then there's these details that you're
12
like,
brands, which one do I choose?
And I use Cheerios all the time. I'm gonna get sued by Cheerios one day, but because literally there's the old school Cheerios that we grew up with that was 3 grams of fiber, 1 gram of sugar, and it was a pretty good breakfast choice, all things considered in America. And then there's now 17 different versions of Cheerios, and they have 3 times the sugar, 1/3 of the fiber.
Right.
And most people think those other versions are the healthier one because of our healthcare marketing, right? All the high protein, the multi-grain.
High fiber, organic.
Yes. So I was with a family in the grocery store, and it was a teenage son, and he was picking out the Cheerios, and I was kind of explaining the difference between them. And I pulled out the old school Cheerios, and he goes, well, I can't eat those. And I said, well, why not? He's like, those are the baby food Cheerios. Those are just made for babies. But that's really what he thought, because he had only seen babies eat them.
Right.
And it's just amazing to me how much food has changed in a couple generations.
It's marketing and branding.
It is.
So let's market and brand something else.
Yeah. And could you imagine going to the grocery store and being in the checkout line and having someone say, hi, I'm a health coach. Do you mind if I take a look at your cart?
Wouldn't that be amazing? Do you want some help with your cart?
Yeah. And be like, well, we can make this swap, and it would save you money. It's going to make you healthier, and
I feel like I would wait in line for the health coach to bring me around Whole Foods.
Yes. So that's what we're going to try to do.
Oh,
we're going to try to we're going to try to get provide ways, build this network out so that nobody has to grocery shop alone.
I love that. As part of PeaceHealth?
Yes.
Tell me more about that. That sounds amazing.
This is what we're building because we have a great culture and everyone wants to give, and we're doing a lot of volunteering. And I can go volunteer at a food bank and I can pack a box. But if I share my nutrition knowledge, I can say, listen, I can also lead a group shopping trip. I can help somebody meal plan. I can meal prep. I can do some other things, and we can give back more to our communities. And if there's one thing I know for sure is that we are all in this together. If you look at the financial models of healthcare, whether we have one payer or insurance, my health is connected to your health. You cannot convince me any different.
Okay, yeah, right.
And so I just know that by educating our workforce and being able to give to our communities better, it's going to make me healthier. It's going to make all of us healthier.
And it's going to make you happier. When you start to give, you get, right? When you start to actually contribute, you find your passion. So I love that. I thought I found the best place to work in IIN, but that sounds like, I love to hear about companies doing great things like that.
PeaceHealth is amazing, and it's slow, and like I said, we're still healthcare, but we're building this and we believe in it, and we're seeing every step we take. We keep making the next right decision, and then we see these new opportunities. And by getting connected to our communities and our partners, food is so communal. It's like really who we break bread with. And somehow we got lost in this, like, my health is just about me and I deserve to be healthy because I made these choices. And that's not what herd immunity is. I mean, we're still herds, we're still community, we're still connection. And, I love those principles of IAN about that community and that connection, and making it okay to talk about, like, why would you drink that Coke? Your pancreas is screaming at you and you're not gonna.
It removes rust. Yes. It removes rust from metal, that Coke. Yeah. And now it's in your body.
So try this. And, and again, I think we worry a lot in healthcare with our aging population about isolation, right? Loneliness and how dangerous that is. And so it's like, here's this thing that you and I are gonna do multiple times a day. We're gonna make hundreds of choices about what to eat today. And we're gonna be stronger together if we can
stronger together.
Make those decisions and share it, and it feels better and all of those things. But the more isolated we get, I think we take some step back.
I agree. I just thought of something because I was thinking about our two companies, and you chose us for your health coaching training. Did you look at any? So it's a busy world out there. When Joshua started this company, let me step back for a second. 30 years ago, he was the one and only health coaching school out there. He defined health coaching and grew it along the ways. And a lot of the people that were his students graduated and started health coaching programs. And we're very proud of that because we've taught the teachers. But now there's more competition in the marketplace. So when you were choosing your education provider, why? Why IAN?
A couple reasons. The medical model is very standardized. We have physicians, there's this path, this is how you become a nurse, and certainly registered dietitians. It's a very structured pathway for good reason. And I always try to remember, decades ago, we didn't have nurse practitioners. We didn't have physicians' assistants. We created those other lanes. And so when I looked at health coaching, I didn't want it to feel like the medical model. I didn't want it to be a prescribed formula. I wanted it to really think about developing people into helping other people make decisions. So the motivational interviewing was huge. It's like, that individuality, I don't want to teach a doctrine. I don't want to be promoting one thing or other. You get to make your choices. You're the expert in you.
Yes.
And I wanted to have an army of people that can help you think through that decision and help you structure whether you're testing by elimination diet, however you're going down that path that can be along that. And so it really, to me, is not necessarily about the knowledge. We do a lot of education in healthcare. We're always educating ourselves on the newest thing, but we spend very little time in those human skills. And some of our best caregivers, our best employees, they get the patient part. Now, maybe they went to high school and they've been a medical assistant their whole life, and they want to develop personally and professionally, but they don't want to go back to nursing school. It's not the right time in their life. It's not what their dream is, but they want to give. And this is a way for them to develop themselves personally, professionally, and give that back. And I think people find their way throughout the program and find their specialties and their niches. And it has connected us. Again, we have caregivers that were in Alaska, and their daily work looks a little different. And one of the really cool things up there is that the fishermen that come in, they can make a donation to our long-term care facility, so those people can eat fresh fish every night.
Oh, that's amazing. I love that.
And that was because one caregiver was like, I can figure this out. We can figure out the right partners we need to make sure that this all works.
But did you look at other schools?
Yes, we did.
And you found that ours was most appropriate for you.
It was most appropriate for us for, again, the online learning, which, again, we have different time zones in different areas, and we wanted to feel connected.
Yes.
And we wanted it, I really was connected to a non-judgmental, the spirit of it. Not like I am doing this to learn something. I'm not checking a box.
I'm doing this for enrichment.
Yes, I'm not getting this piece of paper. I am going through the journey. And, it's a hard, also to go to a company and say, will you build this with me? I don't want to buy what's on the shelf. I'm going to stumble along the way in learning the best way to communicate this to my physicians, why this is important, and I want to build this and I want to share it and help me, understand and do that. And so I think that's also was a huge part of saying, okay, the IAN team was like, we'll help you and we'll figure it out together.
And we will. And thank you for choosing IAN.
Great.
Do you have any mottos or any slogans or anything you'd like to leave us with? Something I can
I have so
grab
many.
onto? Okay,
and
let's
they
hear
change.
some.
I am always, thank goodness I don't get tattoos of them because I go through a phase and I'm like, this is my motto, this is my mantra. And then I realize I have a new one. But
What are they today?
today they are run the mile you're in.
Love that one.
Really important. And just make the next right decision.
Make the next right decision. Can we change that? Can we say make the next right choice?
Yeah, next right choice. So
That's
rather
going to
than
be mine. I'm going to take that if you don't mind.
yeah, not get overwhelmed of X, Y, and Z 10 steps down the road. I just focus myself in what is the next right choice today. And once I make that,
Yep. Just make the next right choice. The door will open for you to make the next right choice after that.
yep,
Well, I love that.
yeah, and you're stronger than you think.
That's a good one. I feel like you have more.
I
Okay,
can
keep
do
going.
this.
Keep going. You have more. I can see it on your face.
I mean, they're
And you're
just
stronger than you think. One
Yeah.
more. How about one more?
oh, okay. Well, I think that I try to do everything with gratitude. I sign my
Yes.
emails with gratitude rather than thank you. And I talk about this a lot with my colleagues about that is what I want to put out there, and I do it as a daily practice. So those emails that I send, that just reminds me how I take those things into practice. So I'm always looking for those pieces of integration into my own life.
That's my favorite one. With gratitude.
With
We're
gratitude.
ending there because when you start to appreciate what you have and you realize you're in abundance already, those pesky aspirations that sometimes have you living in the future just go away. So with gratitude,
With gratitude.
thank you for coming.
Thank you.